So insulin resistance is pretty much causing most metabolic diseases. So I have said that salt, when you're low salt, your body will increase sugar cravings, confusing the signals. But also, what would make salt actually help insulin resistance?
Through a variety of mechanisms. And number one, it turns off all these stress hormones from the adrenal glands. When we touched on it earlier, when you're low in salt, the adrenals go into action to try and release hormones to cause you to not pee out sodium from the diet. So salt's such an important item. People get incredibly sick when their sodium levels fall just below the reference range. I mean, during COVID, that was a disaster. People had low sodium. I mean, in our office, we do so many saline IVs. I can't even tell you, it's people love them. And POTS people, they have trouble maintaining their salt levels. They need, a lot of times IVs of salt, and particularly when the weather's hot, these people have a lot of trouble, and, they can lower their blood pressure so much. So the adrenal glands respond. The adrenal glands sense the stress of the body when sodium levels are low. It releases the hormones to try and reabsorb sodium. Also releases these stress hormones like epinephrine, cortisol, and it turns into a mess in the body. And cortisol can cause elevated blood sugar, and block insulin, and people can't sleep, and then they get anxious, and they get more depressed, and it just goes on and on and on. It's like chasing your tail. And sometimes the fulcrum of that treatment, the main thing, is salt, and just getting their salt levels up and trying to get them off the drugs that they're on. That's trying to block these hormones that are being, the drugs aren't treating the underlying cause of the problem. The underlying cause of the problem is lack of sodium in the diet.